Hey everyone, and welcome back for another deep dive. Today we are talking about something that I think a lot of you are probably dealing with, and to be honest, I am too.
Yeah.
It's that posterior hip pain,
Yeah.
aches in your glutes that just won't quit, maybe even piriformis syndrome or sciatica.
Yeah.
So if you've ever felt like sitting for too long or even standing up for too long, or even walking is a challenge because your hips are just not cooperating, this one's for you.
For sure.
We've got some excerpts from this book on mobility exercises that I think are going to really help us out here.
Yeah.
It's all about practical techniques and things that you can actually implement to feel better.
It's amazing to me how many people just kind of accept hip pain as a fact of life.
Yeah.
Yeah. Especially these days when we've got desk jobs and, people are commuting a lot.
Totally.
But what if I told you that there are ways to actually address the root cause of that?
Okay. I'm listening.
And not just mask the symptoms.
Yeah, that's what I want. Exactly.
I want to just put a Band-Aid on it.
Right.
I want to fix it.
I want to get to the bottom of it.
Yeah.
Yeah.
So the book talks about something called ass lamination.
Okay.
And the name alone, I'm like, okay, I'm interested. Tell me more.
Yeah, it's a catchy name, but it really gets the picture across.
Okay.
So think about, your glutes and your hip rotators, all those muscles that are kind of helping your legs move.
Mm-hmm.
When you sit for hours on end, especially with your feet kind of turned out,
Yeah.
the fascia, which is that connective tissue that surrounds your muscles, it starts to get compressed and stuck together.
Okay.
So it's almost like you're laminating it.
It's like layers of saran wrap getting all stuck together.
Exactly.
So it's like our hips are literally getting laminated from sitting all day.
Pretty much.
That's hilarious, but also slightly terrifying.
Yeah.
But how does that actually affect our ability to move and function?
In a lot of ways.
Okay.
So think about simple things like getting up from a chair or going for a walk.
If those muscles are tight and immobile,
Right.
those movements become a lot harder, and it can even cause pain.
Yeah.
And then if you try to do something more athletic, like squatting or lunging,
Yeah.
you hit a wall, you just can't move.
It's almost like your hips just... Yeah. I definitely feel that restriction in my own hips, especially after a long day of sitting.
Yeah.
So what's the solution? How do we unlaminate our poor glutes?
So the book recommends a technique called Glute Smash and Floss,
Okay.
which basically uses a lacrosse ball to apply pressure and release those tight spots in your glutes. It's like a deep tissue massage, but you're in control.
Now I'm all for self-massage, but the idea of smashing my glutes with a lacrosse ball sounds a bit intense.
Yeah.
Do I need to be an anatomy expert to do this right? Or am I going to end up bruising something important?
Not at all. You don't need a medical degree to do this.
Okay.
It's more about feeling the changes in your body than knowing the exact muscle that you're targeting. The book actually calls those tight, painful spots your business.
Okay.
And you kind of want to just get in there and explore, and you'll know when you hit the right spot.
Yeah, I was going to say, you definitely know when you hit the right spot.
Oh, yeah, for sure.
But how do I know if this smashing and flossing is actually making a difference?
So there's this great anecdote in the book about what's called the butt acuity test.
Yeah, okay.
So after mobilizing one side of your glutes for a few minutes, try squeezing both sides of your glutes at the same time.
Okay.
And you should feel the side that you worked on contracting more forcefully.
Wait, seriously?
Yeah.
So I can feel a difference in strength from just a few minutes of rolling around on a lacrosse ball.
Yeah. It's pretty cool. It basically illustrates how releasing that tension allows the nervous system to communicate with your muscles more efficiently.
So we're removing the handbrake and letting our glutes finally fire on all cylinders.
Exactly.
I like that analogy.
Yeah.
So it's not just about pain relief.
Yep.
It's about actually improving how our muscles work. But what about those aches that kind of creep up higher, in the upper glutes and maybe even the lower back?
So that's where the high glute smash and floss comes in.
Okay.
So basically a targeted upgrade to the regular glute smash.
Okay.
This one focuses on the muscles that are really important for hip extension.
So is it a totally different technique, or is it just a variation of the glute smash?
It's pretty similar, but with a twist.
Okay.
You want to elevate your feet on a box or a bench
Okay.
so you can really get into those high glute muscles.
So elevating my feet gives me better access to those higher muscles.
Right.
But how does that change the mechanics of the smash?
It basically changes the angle of your hip,
Okay.
which allows the lacrosse ball to sink deeper into those upper glute muscles
Oh, gosh.
and really work out the tension.
Okay, so it's like using a different lens to focus on a specific area.
Exactly.
Now let's move on to those adductors, those inner thigh muscles that we always forget about until they start screaming at us.
Yes, the adductors.
What happens when those get tight?
Well, they can limit your squat depth, make it harder to bring your legs together, and even contribute to knee pain.
Oh, wow.
It's all connected.
I think a lot of people associate the adductors with like groin pulls and stuff.
Yeah,
But it sounds like they're a lot more involved than that.
definitely.
So the book gives us 3 variations for addressing this tightness.
Okay.
Using a foam roller, a barbell, or what they call the super friend technique.
Yeah, those are the 3 main ones.
Okay, I'm intrigued. Foam roller, barbell, super friend. It sounds like a workout party.
Oh.
Break those down for me. What are the pros and cons of each approach?
So with the foam roller, you're basically using your own body weight to apply pressure.
Okay.
So you lie on your side with the roller positioned under your inner thigh and just slowly roll back and forth.
Got it. So kind of a general approach hitting the whole muscle group.
Exactly.
And then what about the barbell technique? Is that more intense?
So the barbell technique, you can actually do that with a smaller bar too, like a little battle star if you have one of those.
Okay.
But it allows you to really get more targeted pressure.
Okay.
So you place the bar on top of your inner thigh and lean forward to apply pressure.
Mm-hmm.
And you slowly roll it along the muscle to hit those trigger points.
So it's like a precision tool for getting into those stubborn knots.
Exactly.
Okay, now this super friend technique.
Yeah.
I'm a little apprehensive about letting someone step on my inner thigh,
Yeah, this sounds a little intimidating.
even if they are my best friend.
Right.
So how does that one work?
So basically, your partner is going to apply pressure to your inner thigh using their foot.
Okay.
They can either just stand on it gently,
Mm-hmm.
or they can use kind of a heel-to-toe motion to work out those knots.
So I can see how having another person apply pressure could be helpful,
Yeah.
especially if you have some really deep knots that are hard to reach on your own.
Right.
But I'm also thinking about like the safety aspect here. How do we make sure this doesn't turn into like an accidental wrestling match?
It's really important to start slowly and just communicate openly with your partner the whole time.
Yeah.
Make sure they understand your pain tolerance and adjust the pressure accordingly.
So it's like a delicate dance of trust and feedback.
Exactly.
All right, so we've covered ass lamination, glute smashing, and now adductor smashing with a barbell and a friend.
Quite a workout.
That is a lot to unpack. I'm already feeling like I need to go find a lacrosse ball
Yeah, definitely a lot to take in.
and start experimenting.
But that's the beauty of it. You know, you can really explore and find what works for your body.
Yeah, I love that. So before we get too carried away with our lacrosse balls and super friends, why don't we pause here for now?
Okay.
We'll be back in part 2 to dive even deeper into the specifics of these techniques and how to tailor them to your own individual needs. So stick with us. There's more to come.
Sounds good. Welcome back. Glad we could pick up where we left off on this whole posterior hip pain situation.
I'm ready to get my hands dirty, or I guess bally in this case with these techniques.
That's the spirit.
So let's revisit that glute smash and floss. We've got our lacrosse ball. Where exactly are we putting this thing?
So you want to find those tight, tender spots within the fleshy part of your glute muscles.
Okay.
So position the ball on the side of your hip and just kind of explore until you find a spot that feels like, oh yeah, that's the one.
So we're actively searching for discomfort, like it's a treasure hunt for tight spots.
Exactly.
But we're not just parking the lacrosse ball there, right? There's movement involved.
Right. You want to move your body around the ball, almost like you're flossing between the muscle fibers.
Okay.
The book suggests some specific movements that can really help work into the tissues.
Okay.
So things like externally rotating your leg, dropping your knee towards the mat, and even pulling your knee in towards your center.
So a combination of pressure and movement is the key. And like you said earlier, we don't have to be anatomy whizzes to do this effectively. It's more about tuning into our bodies and finding what feels right.
Exactly. Trust your body's signals. If something feels good, keep exploring. If it's too intense, back off a bit.
Okay, good advice. Speaking of feeling intense, how does the high glute smash and floss differ from the regular version? Is it all about placement?
The placement's key, but you also want to think about maximizing your leverage so you can really target those upper glutes.
Okay.
The book recommends propping your feet up on a box or a bench to really hone in on this area.
Okay, so propping up my feet gives me better access to those higher glute muscles. But I'm curious, how does elevating my feet actually change the mechanics of the smash?
It changes the angle of your hip,
Okay.
which lets the lacrosse ball sink deeper into those upper glute muscles and work out the tension.
Makes sense. It's like using a different lens to focus on a specific area.
Yeah, good analogy.
Now let's move on to those adductors, those inner thigh muscles we always forget about until they start screaming at us.
Yeah, the adductors are often neglected.
We've got our three amigos, the foam roller, the barbell, and the super friend. What are the key differences in how we use these?
Okay, so with the foam roller, you're basically using your own body weight to create that pressure.
Okay.
Lie on your side with the roller under your inner thigh and slowly roll back and forth, making sure to cover the whole length of the muscle.
Got it. So the foam roller is like a broad stroke approach, working the entire adductor muscle group.
Mm-hmm.
What about the barbell technique? How's that different?
So the barbell technique, or you can use a smaller bar, like the little battle star if you have one of those.
Okay.
It's a more targeted approach.
Okay.
Almost like a laser pointer for knots.
Okay.
So you place the barbell on top of your inner thigh and lean forward to apply pressure.
Mm-hmm.
And then you just slowly roll the barbell along the muscle
Okay.
to hit those specific trigger points.
So it's like a precision tool, allowing us to really pinpoint those stubborn knots. Now, what about this super friend technique? I'm still a little apprehensive about letting someone step on my inner thigh, even if they are my best friend.
It's understandable to be a little hesitant with that one.
Yeah.
But communication and trust are super important here.
Okay.
So basically, your partner is going to apply pressure to your inner thigh using their foot.
Yeah.
They can either just stand on it gently or use kind of a heel-to-toe motion to work out those knots.
I can see how having another person apply pressure could be really beneficial.
Yeah.
Especially if you've got like really deep knots that are hard to reach on your own.
Right.
But I'm curious about the safety aspect. How do we make sure this doesn't turn into an accidental wrestling match?
It's all about starting slowly and communicating with your partner the whole time. Make sure they understand your pain tolerance and can adjust the pressure accordingly.
So it's like a delicate dance of trust and feedback.
Right.
Shifting gears a bit, let's talk about voodoo flossing.
Yeah.
You mentioned it earlier, and I've got to admit, the name alone has me intrigued.
Yeah, it's a very catchy name.
And maybe a little intimidated. What exactly is voodoo flossing?
So voodoo flossing involves wrapping a compression band around the target area, which could be your groin, your high hamstrings, or both.
Okay.
The compression basically helps restrict blood flow temporarily,
Okay.
which can actually be really beneficial for breaking up scar tissue and improving mobility.
Okay, so we're essentially creating like a temporary tourniquet with this compression band, but then what? Do we just stand there and look intimidating?
No, definitely not.
Yeah.
The magic happens when you combine that compression with movement.
Okay.
So the book suggests doing dynamic leg swings like air squats or leg curls
Okay.
while the area is compressed.
So it's like we're wringing out the muscles, getting rid of the gunk, and restoring their ability to move freely.
Exactly.
That's a vivid image. But how do we know if this voodoo flossing is actually working? What kind of results should we be looking for?
You'll probably notice an immediate increase in your range of motion and a decrease in stiffness. Over time, you might also see improvements in your squat depth, hamstring flexibility, and even a reduction in pain from old injuries.
That's impressive. So we've covered glute smash and floss, high glute smash, and floss adductor smash with like 3 variations, and now voodoo flossing.
We've covered a lot.
That is a lot of different tools and techniques to address posterior hip pain and improve mobility. It can be a little overwhelming to know where to start.
It's definitely a lot to take in.
Yeah.
But the key is to approach it with a sense of curiosity and just experiment a little.
So we don't have to do everything at once. We can kind of pick and choose what feels right for our bodies.
Exactly. Listen to your body and start with one technique that really resonates with you. Maybe it's the glute smash and floss. Maybe the voodoo flossing calls to you. Experiment and see what feels good, and then gradually incorporate other techniques as you become more comfortable.
That's a relief to hear. So before we wrap things up, why don't we take a quick break to absorb all this information? We'll be back in part 3 to discuss how to integrate these techniques into a personalized routine and leave you with some final thoughts to ponder. And we are back for the final part of our deep dive into, conquering that posterior hip pain. I don't know about you, but I'm already feeling a little bit less laminated just from talking about all these techniques.
I know what you mean. Sometimes just understanding the mechanics behind it all can be so helpful.
Yeah.
But the real magic happens when you actually start putting this knowledge into practice.
Totally. So let's bring it all together. We've covered a lot of ground here, from glute smashing to voodoo flossing to adductor releases and, just the fact that our muscles are all interconnected, what are some of the key takeaways here? What do we really need to remember?
I think the biggest takeaway is that you don't have to just live with this hip pain. It's not just a normal part of life.
Right.
There are things you can do to actually fix the problem.
Yeah, and what I love about all these techniques is that they're so accessible.
Yeah.
You don't need a fancy gym membership. You don't need a personal trainer.
Right.
You basically just need a lacrosse ball, a compression band, and a willingness to get to know your own body.
Exactly. It's all about taking ownership of your own well-being. Empowering yourself to move better and feel better.
I love that. But I'm guessing consistency is key here.
Oh, absolutely.
It's not like I'm going to do one glute smash and all of a sudden I'm cured.
Right. It's got to be a regular thing.
Okay, so how do we make these mobility techniques a regular part of our lives?
Well, I would start by figuring out where you're feeling the most discomfort. Is it your glutes, your adductors, your hamstrings? Then pick a technique that targets that specific area and just commit to doing it for a few minutes each day.
So instead of trying to do everything at once, we focus on one thing and kind of build from there.
Exactly.
But how do we know if we're doing these techniques correctly? Are there any signs we should be looking for?
Your body is going to be your best guide here.
Okay.
Pay attention to how you feel.
Okay.
If you're feeling any sharp pain, back off a little bit.
Yeah.
But if you're feeling a gentle release or an increased range of motion, then you're probably on the right track.
So it's like we're tuning in and listening to our bodies. It's a conversation, not a dictatorship.
I like that.
But what about those times when we hit a plateau? What if we've been doing these techniques for a while, but we're not seeing any more progress?
Yeah, that's a good question. It's natural to hit a point where you feel like you're stuck.
Right.
But remember, our bodies are incredibly adaptable.
Yeah.
So if you're feeling stuck, it might be time to switch things up.
So kind of like with any workout routine, we need to keep challenging ourselves to see results.
Exactly.
But how do we do that with these mobility techniques?
Well, you can try different variations of the same technique.
Okay.
So for example, if you've been using the foam roller for your adductors, maybe try switching to the barbell technique, or even grab a super friend and get them to help you out.
Okay, so changing up the tools can help us bust through those plateaus. What else?
Another thing you can do is really focus on the quality of your movement. So instead of just going through the motions, really tune into the sensations in your body.
Okay.
Are you breathing deeply? Are you engaging the right muscles? The more mindful you are, the more effective the techniques will be.
So it's not just about doing the movements, it's about being present in the moment.
Yeah, exactly.
And something that just came to mind is that we've been talking a lot about the physical side of hip pain, but there's also a mental component to this, right?
Absolutely. How you think about pain can really impact your experience.
It can either make it worse or it can give you the power to overcome it.
Exactly. If you believe that pain is something you just have to endure, you're probably going to feel helpless.
Right.
But if you approach it with a sense of curiosity and a belief that you can heal, you open yourself up to a lot more possibilities.
So it's like shifting from a victim mentality to a warrior mentality.
Exactly.
We're not at the mercy of our pain. We can actually do something about it.
Right. And remember, healing is a journey. It's not a destination. So there will be ups and downs. But the key is to keep moving forward.
I love that. This has been such an insightful deep dive. I feel so much more empowered to take control of my own hip health.
I'm glad to hear that.
I'm ready to grab my lacrosse ball, enlist a super friend, and get to work.
That's what I like to hear. You are your own best advocate. So listen to your body, trust your instincts, and don't underestimate the power of taking care of yourself.
Well said. Thank you so much for all this amazing info today. It's been awesome chatting with you.
It's been my pleasure. Until next time, keep moving, keep exploring, and never stop learning about your own body.
And to all of you listening out there, we hope you feel inspired to take charge of your hip health and unlock your full potential. We'll see you on the next deep dive.